Thankfully, there are early signs that the actions that we're taking are working. The rise in the number of cases is slowing and falling in some parts of the country, like London and Scotland. At the same time, the number of vaccinations is going up. Like many of you, I've been talking to members of my family who've just had the call to be vaccinated. It's a really emotional moment when people get vaccinated. It means so much to people because this vaccine brings safety to that individual and it marks the route out for us all from this pandemic. And I'm very proud to be able to tell you that as of last night, we have vaccinated 78.7% of all over 80s. That's almost 4 in 5 of everyone aged over 80. And I'm delighted that you can see from these figures that there's so much enthusiasm for vaccination amongst the over 80s because octogenarians know what scientists know, which is that the vaccine saves lives. Of course, the rate-limiting factor to this vaccination program remains supply. As we know, supply is tight. We've had a very strong performance in this past week, and I'm confident that the NHS will be able to deliver every shot that's made available to it. To help with that, today we've opened a further 32 large-scale vaccination centres, including at Blackpool Winter Gardens, the Black Country Living Museum, better known to many as the set of Peaky Blinders, and London's Francis Crick Institute, which itself is no stranger to human ingenuity. And I'm determined to get vaccine take-up as high as possible. Today we're funding councils to enhance their vital efforts to engage those who are hardest to reach through our Community Champions scheme. As of today, 6.6 million have now received a vaccine against COVID-19. That's more than 1 in 9 of the adult population. On Saturday alone, we gave nearly 500,000 jabs. And in the last week, 2.5 million people have been vaccinated across the UK. That's a rate of more than 250 people a minute. We're on track to offer everyone in the top 4 priority groups a jab by the 15th of February. And if you are in one of those groups, one of the top 4 priority groups, and you haven't had the call yet, don't worry, the NHS will be in touch. It is a truly national effort, and alongside the GPs and the pharmacists and the other NHS staff, and of course the armed forces who are working so hard, alongside all of them working every weekend, every evening often, I particularly want to thank the 80,000 people who've stepped forward to help deliver this, doing things like volunteering to stand in car parks for 8 hours a day in the freezing cold to ensure that elderly people can safely get to the vaccination centre. It's truly heartwarming, and we've seen this selfless attitude towards the vaccination programme, and it makes me really proud, and I'm very, very grateful to all those who've stepped forward, because we know that the responsibility for the fight back against this disease rests on all of us. This is equally true when it comes to maintaining the rules and social distancing. Social distancing works by denying the vaccine the social contact that it needs to spread. And I want to reiterate an important point made by the chief medical officers and the clinical advice that they've been giving. Even if you've had the jab, the rules still apply. There's 2 reasons for this. First, because the protection takes time. Your body's immune system is only fully trained up around 3 weeks after your jab. And even if you have the protection yourself, we still don't know whether you'll be able to pass coronavirus on to someone else. We're monitoring that very carefully, and we'll publish information on it as soon as we have it available. So this is not a moment to ease up. The success of the vaccine rollout means we cannot put this progress at risk.